Welcome back. Tomorrow, it's hard to believe, will mark 4 years since Governor Mike DeWine signed an executive order declaring a state of emergency in Ohio because of the COVID-19 pandemic. It was really one of the first big signs that the virus is going to change our world.
And the pandemic also changed so many lives for people who got sick and never fully recovered. The most recent household pulse survey conducted by the National Center for Health Statistics found that about 30% of Americans who had tested positive for COVID-19 had long-term symptoms. It was highest, just barely, among 40 to 49-year-olds. Now, the survey also found that here in Ohio, that rate is even higher at nearly 35%. Tonight, I'm following through with a doctor and a patient I've spoken with in the past to see what we've learned about long COVID.
How long is this going to last? When am I going to get better?
Questions that Hinda Stockstill is still asking herself today, 2 years since we first talked. Hinda was a healthy 34-year-old before getting sick in the initial COVID-19 wave and then developing long COVID.
Hinda, are you doing better, worse, or perhaps just different now?
I have this waxing and waning of symptoms, so I could have, 2 or 3 weeks of feeling really good and feeling quite normal. And then all of a sudden I come down with chills, dizziness, nausea, a severe migraine, and then it's a couple weeks where I struggle to get out of bed.
Along with chronic fatigue syndrome, Hinda's developed POTS, or postural orthostatic tachycardia syndrome, which is when your heart rate spikes after standing from sitting or lying down.
And so I've been dealing with that diagnosis and trying to take care of myself while still working full-time remotely from home.
How has COVID and long COVID impacted the trajectory of your life?
It's probably one of the worst things that I have ever experienced.
At 37, the physical and emotional toll of long COVID has been significant. She's lost friendships, but made new ones. People who understand her good and bad days, she tells me.
I might call you and just need, support or just need your prayers. Would that be okay? And the new friends that I have met have been very wonderful and very accepting. But life kind of, when you're sick like this with a chronic illness, it's like life kind of just starts to pass you by.
She says the lack of answers about what's happening in her body at a cellular level and how to fix it is frustrating. But Hinda finds hope in seeing others heal and knowing that research and studies are underway to improve outcomes for long COVID.
There is hope at the end of the tunnel.
Medical director of University Hospital's COVID Recovery Clinic, Dr. David Rosenberg, says there's no silver bullet yet for treating long COVID.
It's really a diagnosis of exclusion.
He says COVID has brought to light the adverse effects of chronic inflammation from infection. He says with long COVID, you treat each affected organ system individually.
The number one top symptoms are chronic fatigue, and there's no question about that. Brain fog, confusion, aches and pains all over. Autonomic dysfunction is really very common, where they have unexplained tachycardia and dizziness, sleep disorders.
Dr. Rosenberg says they've treated about 1,000 patients in the 3 years UH's COVID clinic has been open. He says most people will get better and says staying up to date on vaccinations is critical.
That's probably the number one thing that you can do to reduce the prevalence and incidence of long COVID is prior vaccination.
The National Institutes of Health has recently invested more than $500 million to continue its work finding ways to better prevent, test for, and treat long COVID. Now, that funding is for the Recover Initiative, which was created back in 2020, and the initiative is already shining new light on long COVID. One study based on Recover data found 1 in 10 people who had COVID while pregnant will develop long-term symptoms. Another study of children found 1/3 of children with long COVID still had symptoms 1 year after infection. One doctor says there hasn't been a slowdown in patients dealing with long-term symptoms.
We still have between 50 and 100 referrals coming in a week. But with that number of patients coming in, we have more referrals than doctors that can see them. So we certainly need more clinical resources put towards caring for patients with long COVID.
Dr. Rosenberg said the same thing, that the patient volume has stayed similar here as well, here at home. Now, the NIH says 98,000 people are participating in Recover studies. That includes here in our area through more than 300 clinical trial sites nationwide.